I am a pediatrician. That's a specialist in infants, children's, and adolescents. Probably when I was about sixth grade or so, I had a very good pediatrician where I grew up in La Cañada, and maybe that inspired me. But I kind of wanted to be a doctor, certainly from the time I went into high school, because I was really oriented towards science and mathematics. Actually, after I graduated from college, I had applied to 12 medical schools, at least. You had to apply to lots of schools because it was very competitive. And I got on a waiting list at one school or two schools, but I got rejected everywhere else. Despite having a good GPA and doing well on the MCATs and being a teacher assistant as my senior year in biology at Loyola University. So I had to apply again the next year after working as a lab technician at LA County USC Medical Center. And it looked like I wasn't going to get in again. I got on a couple of waiting lists, and I said, well, I can't do this the rest of my time. I got to go back to school. So I applied to the UCLA School of Public Health and was accepted and was going to get a master's in public health. And as soon as I did that, I got a call from Creighton University School of Medicine on a Tuesday, and they said, can you be back here Friday for orientation? We have a spot for you in the class. So I quit my job, got on a plane the next day, and I was in Omaha, Nebraska on Friday. Ooh, that's a tough one. There was a young man who came in when I was an intern, so I did not have a lot of experience at that point. And he had some very confusing symptoms. He had a fever, he'd been having seizures, he had hypertension, high blood pressure. It was really hard to put together what was going on. We thought he had encephalitis. We weren't sure what we were dealing with. And then one of the consultants came in and we started discussing the case. And he said, he's got hypertension. That's inflammation of the blood vessels in the kidney. He's got encephalitis symptoms. That's inflammation of the blood vessels in the brain. And he's having abdominal pain. That's inflammation of the blood vessels in the stomach area. He said maybe there was a syndrome called Henoch-Schönlein purpura, which is a fairly rare thing, but you see it occasionally as a pediatrician. He had not developed the rash yet, and unfortunately I had to go off service. I was going from pediatric ward to the NICU the next week. He had not developed a rash yet, but after I left, he developed the rash that was characteristic of Henoch-Schönlein purpura. It was a very, very difficult case to figure out initially. I don't know if there's a best story. I think the thing that I enjoyed the most, if that's what you want, is dealing with families. I think in today's world of medicine, pediatricians and maybe family practitioners in some cases, but pediatricians overall are the true GPs now because we deal with the children, but we also deal with the parents, and we have to allay parents' fears and answer all of their questions. So we're really treating the whole family. And quite frankly, most of the patients I dealt with when we had a good relationship, which was, of course, most of them, they almost made you feel like a member of the family, and they treated you like a member of the family, and that was very gratifying. Well, my first practice when I came out of residency was my own practice over in Canyon Country. So it was just Thomas J. Connolly, MD, pediatrician, general pediatrics. I worked there as a solo practitioner for about 2.5 years, and when Facey Medical Group, who was primarily in the San Fernando Valley, Granada Hills area, came up here, they wanted to open an office, so they talked to me and asked if I wanted to join them. They basically purchased my practice, got me out of debt, and I became a full member of Facey Medical Group and was the first Facey medical physician in the Santa Clarita Valley. Well, as I talked about before, the most gratifying part of being a doctor was really feeling like you were part of the families you were working with. And I do miss that. That's the biggest thing I miss having retired. It's wonderful to have all the free time and have worked hard all those years. So now my wife and I can travel and we can do a lot of other things that we like to do. And I can spend lots of time with my grandchildren. So that's enjoyable, but I do miss the dealing with the families that I dealt with all the years and watching the kids grow and develop and feeling part of those families. Well, we're getting into the age of AI, which I don't know how that's going to affect medicine. I would encourage anyone interested in the sciences or in medicine to apply themselves very strongly to the sciences and mathematics. But you still have to get some humanities. You don't want to become so involved in science and math that you lose your humanity. So, keep that human side of you, the empathy and the ability to see how people are suffering and try and take that into account and make them feel better.